Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about how to use TENS to improve muscle spasticity. So before we talk about TENS, it's important to have an understanding of spasticity. So spasticity is a condition associated with increased muscle tone and stiffness, and that creates resistance to active and passive movement of the limbs. And this can make it problematic and make it difficult to attend to day-to-day tasks such as dressing, cleaning, walking. And it's something your healthcare provider can detect on examination. So as shown here in the image on the right, it can be brought out by sort of passive, quick ranging of the limbs. And it's only found with injury to the central nervous system, meaning injury to the brain, brainstem, or spinal cord. And not all muscle spasms are muscle spasticity. So again, if you feel like you could have muscle spasticity, you should talk to your healthcare provider. So how does TENS work? TENS stands for transcutaneous electrical nerve stimulation. And it involves the application of electrical current across the skin to activate sensory fibers on the skin. And this is different than other forms of stimulation such as EMS or electrical muscle stimulation, NMES or neuromuscular electrical stimulation, or FES, functional electrical stimulation. These three forms of stimulation work to elicit muscle contractions, and they are beneficial for spasticity, but we're not going to talk about them today. So again, TENS, it works on the sensory fibers, and then that information is brought back to the spine where it influences those pathways responsible for spasticity. So what are the benefits of TENS? Certainly the big benefit is that it's evidence-based for spasticity. So on this slide, I have two papers, both systematic reviews that looked at several articles, compiled the evidence, and came to conclusions about the use of TENS. And both reached that same conclusion that TENS can be quite effective for reducing spasticity, both in stroke as well as in other forms of limb spasticity. So again, it's quite evidence-based, but another benefit is that it can reduce spasticity in an affordable way. So this is a quick Google or search that I did on Amazon.ca, took a snapshot of the search, and you can see of these sort of devices, all of them are under $50 Canadian. So if you compare this to medications or private sessions of physiotherapy or toxin therapy, it can be quite affordable. Other benefits of TENS is that it can be combined with other treatments for spasticity. So medications, injections, physiotherapy, bracing, and often it does better when it is combined with other treatments as they work synergistically. They work on different pathways responsible for tone. It's safe and well tolerated, and patients can use it by themselves at home. Now, some people wonder, will it be uncomfortable because you're providing shocks across the skin? Well, if you look at the research, it can actually be beneficial for certain pain conditions, particularly neuropathic pain. So in Canada, we have these guidelines for managing nerve pain after spinal cord injury, and those guidelines include TENS as a possible treatment that can be used for managing pain. So how do you get started? So again, discuss with your healthcare professional whether TENS is appropriate for you. If it is, and you decide to purchase a device, they often look like the one shown here in the top right image. So there's sort of the unit itself, and then there are these wires that sort of connect to electrode pads. Now, these devices can have one or many channels. A channel is really one wire connected to the device connected to two electrodes. The benefit of having two channels is that you can potentially put the electrode pads over several different muscles, which may be beneficial if you have tone at several muscle groups. And the electrode pads, as shown in the image in the bottom right, which are sort of often these rectangular, sometimes circular sort of pads, are placed over the spastic muscles. That seems to be where the most evidence is for TENS. So again, talk to your healthcare provider to determine what muscles are spastic, what spastic muscles are most problematic, and where you should apply these pads. Often over the muscle, you should have these sort of pads separated by at least an inch, as shown by the image here. So when you do get started, you'll notice that on your device, there's many different parameters that can be set up. Now, there are certain parameters that have been studied most for TENS and that seem to have the most benefit for spasticity when you use TENS. So one of these parameters is called frequency. Frequency is how often you're delivering a shock. And so the optimum frequency seems to be around 100 hertz. That seems to be ideal for activating those sensory fibers. There's also a parameter called the pulse width or the duration. That's how long each shock or stimulus is. Again, ideally, it should be set between 200 to 300 microseconds. Another parameter is intensity. It's measured in what we call milliamps or little m big A. And it should be strong enough that you're eliciting paresthesias or tingling under the electrode pads, but still comfortable. Now, when you provide a stimulus, it can be provided as a monophasic shock, which means there's sort of one polarity, or biphasic, an alternating polarity. There's some thought that perhaps biphasic stimulation might be more comfortable than monophasic, so this could be something that could be considered. And you should ideally provide this for about 30 minutes a day. Again, that seems to be where the research is, that if you can do it for at least 30 minutes a session, you'll get benefits. And often the reduction in tone lasts anywhere from an hour to slightly longer, which can be great as it may allow you in that sort of window of period to do things that you might not have otherwise been able to do because your tone is often problematic. So there are certain conditions, certainly, where TENS may not be advisable. Examples may include individuals who have a history of seizures or epilepsy, those who may be pregnant, or those who have implanted devices such as pacemakers where there may exist the potential for that device to be sort of interfered by the electrical current coming from the TENS device. And so to summarize, TENS can be beneficial for spasticity. It's evidence-based. I showed you 2 systematic reviews. Certainly, it's beneficial for spasticity in that it's affordable, it's easy to deliver, it can often provide benefits beyond spasticity, such as neuropathic pain. But to get those benefits, it should be delivered using certain parameters: a frequency around 100 hertz, pulse width between 200 to 300 microseconds, an intensity that elicits these sort of strong, sort of tingling sensation, but still comfortable, and ideally 30 minutes a session. Now, certainly there are some individuals who may not respond, and again, you should talk to your healthcare provider to make sure it's safe for you to use, but also to get some instruction and some guidance about what muscles are spastic and problematic, and therefore where you should put the electrode pads. If you have any questions, please post them in the comment box. I'm the neuromuscular mechanic, and I hope you found today's session handy. Thank you.